blood is very much important preservative. In routine cases, we send viscera as follows. First, we take a 3 seal jar of about 1.5 liter capacity. Then in one bottle, we contain the stomach with its content, 2 to 3 feet or 100 centimeter of small intestine in adults, and in infants whole intestine, small intestine, or preserved 200 centimeter. While in second bottle we contain portion of liver not less than 500 grams, and particularly the portion of the gallbladder. Then a portion of spleen or complete spleen, and half of each kidney in the preservative. Half of each kidney we send because there may be one kidney is non-functioning, so the other kidney is functioning, so we can take the sample or trace evidence, trace of any poison from the functioning kidney. In case of criminal abortion, uterus and its appendages, vagina, they also send in the second bottle. In bottle 3 contains sample of the preservative, which we use in about first and second bottle as a control sample. In our mortuary, we commonly use the saturated salt solution, which is prepared by adding the sodium chloride in a tap water till no more dilution is there. So it will be saturated solution. There is a sealed bottle number 4 containing blood, at least minimum 10 ml of the blood in all suspected cases of poisoning. We should send special viscera. They are liver, which is most important tissue because it concentrates many substances. Heart in cases of strychnine or digital poisoning. Brain in neurotoxic poisons, alkalides, volatile organic poisons. Then bile in case of narcotic drugs like cocaine, methadone, barbiturate, tranquilizer, and opiates. They are concentrated in bile, present found in bile. Then lungs in cases of gaseous poison, hydrochloric acid, alcohol, and chloroform. We take lungs. Vitreous humor in case of alcohol, chloroform poison. Vitreous humor is preserved by keeping it at 4 degrees centigrade for 48 hours. Normally, preservative is no value in it. Okay, though it could be preserved with sodium fluoride. Bone in case we preserve bone in cases of arsenic, antimony, and thallium, radium poisoning. Uterus in cases of chemical abortions. Skin, hypodermic injection. If we found some injection mark, then we take the skin tag from there. Then snake bite, corrosives. Hair and nail in case of heavy metallic poisons. Spinal cord in cases of strychnine poisoning, and CSF in alcohol intoxication. It should be preserved in sodium fluoride. Urine in case of narcotics. Body fat in case of endocrine DDT poisoning. Muscles, when internal organs are badly putrefied, then we take a sample of muscles from the thigh. We collect the samples of blood from, we should collect at least 10 ml of blood in a sterile bottle, and preferably from the peripheral veins like arms or legs. Most preferably, most important is femoral vein. CSF should be collected from cisterna puncture and base of brain and puncture of lateral ventricles. Bone marrow should be collected from sternum, ilium, femur, or vertebra, from any of them, these bones. Urine from suprapubic puncture and muscles, especially thigh muscles, we take as a sample. Spine and spinal cord in routine post-mortem examination, we do not open spinal cord, vertebral column. But sometimes, and mostly we mention that not open in the column of the spinal cord. But in cases of strychnine poisoning, tetanus, and when there is a local trauma to the vertebral column, or when no other cause of death is found on post-mortem examination, then we open the spinal cord, or when the investigating officer requested for it. The common preservatives which are used in our mortuary are saturated salt solution, mostly in all cases of poisoning, including carbolic acid, but excluding other acids. Okay, rectified spirit we use as a preservative for viscera in cases of poisoning by acids, except in case of carbolic acid. As in carbolic acid we use saturated salt solution, and acetic acid and other drugs or phenol group. Poisoning by alcohol, phosphorus, penaldehyde, where saturated salt solution used. 10% formalin is used as a preservative for the tissues sent for histopathology, and preservative for liquid blood is sodium citrate. For urine, we use thermal grain or equal quantity of saturated salt solution. In suspected cases of alcohol poisoning, blood and urine, this should be collected in separate bottles, but never use rectified spirit as a preservative because it alters the concentration of alcohol. In cases of carbon monoxide poisoning, we collect about 100 cc of blood in a test tube and then drop 1 to 2 centimeter layer of liquid paraffin on it. So it make it an airtight, and then this prevents the mixing of the atmospheric oxygen with the carboxyhemoglobin and it's altering its concentration. So then how we dispatch viscera? Viscera plus preservative in this jar in adequate amount in a wide mouth bottle. Lid should be tightly closed and labeled and sealed. These bottles should be filled only 2/3, and remaining 1/3 should be left for the gases formed in the bottle, which are formed in the body tissues, and they should escape from the tissue into 1/3 of the bottle. All the bottles are then kept in a Viscera box, which is mostly a wooden box, which is then locked and sealed with labeling. There is a labeling of viscera in which we write down the name of the deceased, father of, son of, daughter of, wife of, and then viscera, which are contain the name and signature of the medico-legal officer, then number of post-mortem examination, the date and time and place of the post-mortem examination. Then they are ready for dispatch like this. 2 large bottles, and third one is for preservative and extra for one another bottle for blood. Then this locked box are kept in an envelope which is also sealed and then handed over to the police constable in exchange of receipt. The police constable then carries it to the forensic science laboratory for the chemical analysis or histopathological analysis. Along with the keys viscera box, the following documents should be sent, like a copy of Panchnama, autopsy report, requisition letter by MO, medical officer, to the forensic science laboratory to conduct the chemical analysis. So the second topic is exhumation. What is exhumation? Lawful digging of a dead body from a grave is exhumation. The practically gade murtyo kherna. Okay? It is done on order of district and session judge, additional district and session judge, judicial magistrate. The aims of exhumation are: one is identification to confirm the individuality of any criminal or civil purpose arising after death. Cause of death when there is suspicion of foul play or poisoning. Second, autopsy, when the autopsy report is challenged and or done autopsy is conducted by some inexperienced junior doctor, then the relative, we wanted to, on the demand of the request of the relative, the magistrate requested doctor to perform exhumation. When some documents are buried along with the body, then to take out these documents, sometime maybe jewelry, gold with females. And another is a manta body. If a person made a will before death that he should be buried at a particular place, like his or her hometown, then while making these arrangements, he is buried temporarily at the place of death, and then the body is exhumed and buried according to his will. Or when we exhume the body, when a new road is being made and a grave is blocking the way, then this grave is exhumed and there is no autopsy and the body is buried at the side of the road. Similarly, when new town of coroning is made and few graves block the construction, then these graves are exhumed and the bodies are buried at the same distance away from these colonies. What are the precautions taken for exhumation? First thing is, precautions are documentation should be complete, all available records of the case along with the written authority from the judge or magistrate. The body should be exhumed under supervision of magistrate in the presence of a doctor. The police officer should be present to make necessary arrangements such as providing witness for identification of grave, maintaining law and order situation. This is how it performed. This is a peaceful environment of graveyard, and then there is a process of exhumation has been started after identification of the grave. Usually the SHO of the police station in the jurisdiction of which graveyard is situated will make the arrangements under order of the court. The exhumation should be done preferably in the early hours of the day, in the morning hours before the graveyard is open for general public, so that there is some degree of privacy, and moreover the whole process of digging and autopsy can be satisfactorily completed during the natural light. Identification should be done by relatives or deceased, preferably those who were present at the time of burial. Autopsy should be done on the spot, for which the area should be cordoned off with a tarpaulin and no unauthorized person should be allowed there. It is advisable to know the geological nature of the graveyard, and if the grave is waterlogged, then take a sample of the water from the grave. Procedures: first is the documentation, then identification of the grave, then digging of grave, and then autopsy of the dead body, then collection of the samples and labeling and preserving them properly, and writing down the report, autopsy report, then and there. This is a graveyard and start the procedure, and photograph should be made all the process of autopsy, the identification, all the procedure of autopsy. This is how the tarpaulin is formed, the cordon of the area of the grave, and in the presence of the magistrate, doctor, and police. After observing all the formalities, the grave should be dug, taking care that the body or coffin is not damaged. All steps from identification to digging of the grave should be photographed. Take sample of mud soil about 500 grams from above the grave. The body after taking out is identified by the relatives or friends, which is supervised by the magistrate and assisted by the police. Disinfectant should not be sprinkled on the body, and the doctor should conduct autopsy as thoroughly as possible. If the body is decomposed, then look for bony injuries, especially such as a fracture of skull, ribs, or hide bone, to differentiate them from either they are antemortem or post-mortem injuries. Take a sample of mud from below the grave and a control sample of the mud from the same graveyard away from the grave. Sample of coffin also should be taken and preserved. So the sample which we are taking from during the exhumation is soil above the grave and soil below the grave, and control sample from some distance of the same graveyard. Then portion of the coffin, visceras or liquefied matter from their anatomical sites, hair, nail, and bones. They all samples we have taken and preserved and sent for chemical analysis. In cases of suspected poisoning, preserve hair, portion of long bone, preferably 10 to 15 centimeters of shaft of femur. For DNA, take jaw with teeth and clavicle. Limitation of exhumations are advanced stage of putrefaction. There is no value, we can only find the bones and the matters related to bones. And vegetable and volatile poisons are difficult to detect. So no use of exhumation. Histopathology is of no use. Then the body was buried after medico-legal autopsy. Most probably we will not found any cause of death again. Lack of experience of examining medical officer, if we are not having the experience medical legal officer, so it is not necessary that again we dig out the body and under some junior officers, so it's better they do not perform exhumation. Pathologist grave or wrong identification of the grave. If we are not confirmed about the identification of the grave, then there is no need of it. And time limitation for exhumations are in some countries the time limit is fixed. In France it is 10 years, in Germany 30 years, Pakistan there is no time limit. We can perform after 10 years, 20 years, so many years. Okay, this is all about exhumation. And third thing we will discuss is postmortem artifacts. What is an artifact? Artifact means anything which is not real but something artificial. It is a change or feature which was not physiologically or even pathological present in the body tissues before death in natural course of events, but which have been caused or introduced into the body after death, often leading to much confusion about its nature and causative effects, and often resulting in misinterpretation of the medico-legally significant findings. There are four categories of artifacts. One, due to resuscitative or therapeutic measures at the end of the lifetime, and second group between the death and autopsy during transportation of the body from the place of death to the mortuary, then due to injuries or lesion of the organs before death, pathological, or during post-mortem examination. Due to resuscitative or therapeutic measures, history is always very much important in every field of every branch of the medical. So same here, the history is very important. First, if there is a history of hospitalization or in coma or CPR resuscitation, then you can find so many things related there, like a mark of injection during hospitalization or defibrillator chest, CPR during CPR process. There may be a fracture of ribs or sternum, which can cause hemothorax or pneumothorax. Fat embolism from fractured ribs or sternum may be there. Laceration of spleen or liver or diaphragm, they are may be result of CPR, forceful CPR. In case of positive pressure ventilation, there may be emphysema, subpleural air flaps, or tension pneumothorax may be found. This is a defibrillation mark simulating the antemortem event. You can see on the chest, the defibrillating marks. Here are simulating the antemortem ablutions, antemortem injuries. Then another group is the between death and autopsy. They are agonal artifacts. Agonal is the struggle that precedes death, the last moments of the death when the person is in very painful or confusing state of mind and body. So most common agonal artifacts are regurgitation and aspiration. Okay. In case of antemortem agonal reaction, the stomach contents are aspirated and they goes to the lower respiratory tract. They mix with the fluid and mucus and result in choking and death. While in case of post-mortem agonal artifacts is that food particles may reach to the upper pharynx but never reaches to the lower respiratory tract. Vascular collapse or shock before death may result in a congestion of the viscera. Embalming artifacts is an important chemical treatment of dead body to protect from decay. When we insert the trocar for the arterial access or for the cavity access in the abdomen, there may be existing a wound which may change the size and shape, direction, and create a false tract and may be mistaken as a trauma stab wound. Freshly created wound may simulate a stab or gunshot wound. This is trocar insertion from neck and abdomen. Okay, abdominal cavity we enter The trocar and in arteries, subclavian or carotid arteries. So it may simulate or may be mistaken as a stab wound or gunshot. Embalming fluid which we introduce into the vessels, they may extravasate the blood from the veins and arteries and may be mistaken as a bruise. Small bruise may combine to form a large bruise, and embalming fluid interfere in the toxicological analysis, okay, because it contains arsenic most of the time. Then artifacts due to handling of cadavers from transportation, like abrasion, laceration, blood spots on clothes and body which was absent in original. They are transportation injuries, artifacts. From the careless handling of the workers, where mostly what happened when they transferred the body into the mortuary table, the bruise in the occipital area due to the head bumping on the hard surface. They could be differentiated by wiping off the bruise, because if it is post-mortem, it can be wiped easily, but in case of ante-mortem bruise, you cannot wipe it. Fracture of ribs and vertebra may be there because of rough handling of the workers. Then weak and osteoporotic bones may get fractured due to contract rigor mortis. Brush abrasions on the back may be present by dragging the body. If abrasions are present, they can be differentiated by antemortem and postmortem. About all these injuries like abrasion, bruise, and laceration, you will learn in upcoming lectures of forensic in which traumatology. Okay, antemortem. If the abrasions are antemortem, then they look brownish or reddish, and scab is there. Scab means the healing process. Bleeding surface is present if it is fresh, while in case of post-mortem there is just a brown parchment like, there is no scab formation, no bleeding, and no vital reaction are there, no redness, swelling. So all the vital reaction they are absent in case of post-mortem abrasions. Same in case of laceration. If they are antemortem, there will be vital reactions and margins are bruised, while in case of post-mortem there is no vital reaction and no bruising. This is a post-mortem abrasion. You can see there is no vital reaction, no redness, no swelling, and no presence of blood. This is a post-mortem abrasion. In case of bruise the same, there is a swelling, while in case of post-mortem there is no swelling. And then extravasation of blood will impact the color to the affected area in case of antemortem, and there is a color change which is the most important part of the bruise. It will change the color due to the blood pigmentation which were disintegrated into extravasation, after extravasation into the tissues, which this color change is not there. And at the end we can microscopic examination can confirm between the antemortem and postmortem bruise by the detection of enzymes. Artifacts due to rigor mortis, while if the person is stiff due to rigor mortis and the body is moved during the movement or transportation, there may be a breaking of rigor mortis, which result in asymmetrical rigor mortis, which may cause misinterpretation of time since death. There may be a heat stiffening, a cold stiffening, which may pose as an artifact against rigor mortis. Okay. How to differentiate the heat or cold stiffening to the rigor mortis? Rigor mortis in normal weather, normal conditions, while heat stiffening when the temperature of surrounding is more than 65 degrees centigrade. In similar way, cold stiffening when the body is exposed to freezing temperature. Rigor mortis naturally passes off in 36 hours, while heat is stiffening. It remains till the muscle and ligaments soften due to decomposition, while cold stiffening due to freezing of the body fluid and solidification of the subcutaneous fat. Heat stiffening much more marked than the rigor mortis, and rigor mortis never develop because the muscle protein is coagulated because of heat. So no rigor mortis is there. While in case of cold stiffening, when the body plays in a warm water, stiffening will go and rigor will come. Gas stiffening may simulate the rigor mortis because of stiffening, but it is because of the putrefactive gases which are collected in the tissues. So by the gas, no particular order or appearance of disappearance in case of in case of gas stiffening, which is present in rigor mortis. Joints are not tight, so the body can be moved easily, while in case of rigor mortis, the joints are tightly stiff. No muscle shortening as in heat stiffening. Gas stiffening muscles are the same, but the stiffening is just because of the collection of putrefacious gases in the tissues. So muscles are remain of same length. The stiffening will be passed if gas is allowed to escape by incision over the area. The gas escape, then the body becomes relaxed. This is the normal rigor mortis, stiffening and shortening of muscles. Then this is a heat stiffening, means burned body, the whole muscle protein is coagulated and contractures develop. That is pugilistic attitude, and overheating may causes the burst of skull or burst of abdomen cavity, splitting of the skin and subcutaneous tissues also. This is gas stiffening. You can see there easily that there are signs of putrefaction in there. Bluish or green discoloration of the face and different parts of the body and complete peeling of the skin. This is a typical picture of putrefaction. Artifacts due to hypostasis. We have learned in previous lecture of lividity. While the lividity is started, it is in small patches, may be mistaken as a bruise. Hypostasis is present on the dependent parts of the body and also in the viscera, while the bruise can be anywhere. Hypostasis in the nails, sometimes confused with cyanosis. Refrigeration body, the hypostasis is of pink color, may be mistaken with hydrocyanuric acid poisoning. This is a hypostasis like bruise, and in the initial state the hypostasis develop in patches, so may be mistaken as a bruise. This is a hypostasis in refrigerated body, which is in pink color. Decomposition artifacts. It brings lots of significant changes which can be mistaken as an artifact on naked eye examination. Some are artifact is swollen edematous corpse in early stage, may be misinterpreted as an antemortem obesity. Blood stained froth from the mouth and nostrils may be misinterpreted as a pulmonary edema, asphyxia, head injuries. For this, we can ask about the history of drowning or head injuries to confirm the artifacts of antemortem or postmortem. Postmortem blisters, antemortem blister due to burn or scald, they may be misinterpreted, but the vital signs are not present in postmortem blisters. Postmortem bleeding, there may be a bleeding from the severe blood vessels. They may be mistaken as antemortem bleeding. False groove over the neck due to tight collar or neck tie, they may be mistaken as a strangulation. So with a close observation in history, we can judge them either they are because of strangulation or because of tight collar, or moreover in case of strangulation, asphyxia, ecchymosis, critical hemorrhages are there. When separation of head or suture or burst of abdomen due to the gases, they may be mistaken as a trauma. Okay, the gas in the heart and the blood vessel, they may be mistaken as an embolism, for which we perform alkaline pyrocolol test, gas treatment, in which we can confirm either it is because of oxygen or due to putrefactive gases. Rupture of esophagus or stomach may be due to the gastric juices, which may be misinterpreted as a corrosive poisoning. Hypostatic discoloration of the intestine may be simulated as a strangulated infarcted bowels, and stain on face due to regurgitation may be mistaken as a chemical burns, for which we can perform the chemical analysis. Vagina introitus will be loose, lax and flaccid, with blood stained discharge with bluish discoloration of the mucosa. This is a normal phenomena of putrefaction. In putrefaction, the genitalia become swollen and protruded out. This is normally happening in putrefaction, but may be mistaken as a sexual assault. So we can take a detailed history of vaginal swab or uterus for histopathology. we can confirm it. Okay, decomposition of pancreas may be mistaken as a pancreatitis. Then there is sign of inflammation, fat necrosis will be seen in ante-mortem cases. Fissure or split in the skin may be mistaken as a misinterpreted as a lacerated or incised wound. So these are the things which are found. They may as an artifact, may be found as artifact, maybe as a natural course of death. So we have to rule out either they are ante-mortem or post-mortem. Heat cracks resembling the lacerations. Overheating may cause a splitting of the skin in any part of the body, with burst of skull. Postmortem ante-mortem blister. You can see very well the right side. There is an ante-mortem blister with whiter reaction, redness all around. While in case of postmortem blister, there is marbling present and discoloration of the body. Thus, there is no sign of whiter reaction around the blisters. Artifacts due to animal or insect bites. They are very much important. Rats and rodents, they nibble the body, which is pale and white, while dogs and jackals, which eating the body, the deep impressions are deeper, and they may be mistaken as a stab injuries. Cat bites are small and rounded. In drowning bodies, mostly the lips, cheeks, eyelids, genitalia, and tips of genitalia, finger, toes, and muscle of the limb. The projecting part, they are eaten by fishes, and crabs. They may be mistaken as a homicidal infection while they are just because of animal. So they are artifacts, postmortem artifacts. This is the animal bite resembling stab wound. You can see here. Ant bite resembling like this may be mistaken as an ante-mortem abrasions. Artifacts during post-mortem examination. What are injuries to visceral organ? May be mistaken as ante-mortem injuries. Fracture of skull bone may continue with the ante-mortem fracture. They may be misinterpreted as a whole fracture. Hyoid bone or thyroid fracture may result during the forceful extraction of heart and lungs. There may be bleeding in the neck, which may be mistaken confusion as ante-mortem or post-mortem. So for that we perform enzymatic study to confirm that it is either ante-mortem or post-mortem. What is the medico-legal importance of these post-mortem artifacts, which may lead to wrong conclusion as to the cause of death, mode of death, nature of death, ante-mortem or post-mortem. They may lead to unjustified suspicious of foul play, misguided direction to investigating officer, or miscarriage of justice. So be careful about these things to rule out. Okay, artifact may lead to imprisonment of an innocent and freedom of the guilty. So it is very important. You must learn all about these. Thank you so much for your time.